Hello and welcome back to the Digital Health and Wearable series. Today I have another magnificent episode for you, but before I go ahead, make sure you subscribe to the channel, share with your communities, invite your connections, and also acknowledge our global partner and sponsor, Spirit Digital. Check the solution in digital health and other partners. But before any further ado, I'm going to introduce you to the guest today. I'm delighted to have another magnificent leader. I have the Professor Dr. Koen Kas, which is the CEO at HealthSkouts. He is also a healthcare futurist and a global keynote speaker. Koen, how are you?
I'm fine. Thanks a lot, João, for having me. It's a huge pleasure to be here and to share a number of ideas and new things with you and your audience.
Oh, brilliant! I've been following your great work. You're very active, and you do these keynotes, and you're a futurist in the healthcare industry. So delighted to be here. Thank you so much for accepting my invitation.
Sure, sure.
And go to the first question. We both share an interest in wearables. So, in your opinion, do wearables still have a future?
Yeah, I think so. Yes, I think wearables are in a flux, and I keep saying that healthcare is in the most exciting times ever. I will say the same in 10 years from now. And I think if I look to wearables, I like to start with a short story. The first kind of experience I got with a wearable, I think was 13 or 14 years ago with a beta version of what was called the Fuel Band of Nike. And so for the younger audience amongst you people, maybe they haven't seen that, but that was a little wristband which contained tiny LEDs from greenish to orange to reddish. And basically, what you could do with that is define how many steps you wanted to take. And only when it was reddish in the morning and red turned green, you had kind of accomplished your goal. So when I came home from work, the first thing my kids said was not that, how is it at the job? It was, well, come on, daddy, it still looks no green, it's still orange. And I started to get social control of my kids. That was a cool eye opener because that told me that all of a sudden, something I didn't realize I didn't do or hardly do, move, could start to become something, well, manageable and refundable in a sense. And I'll come back to that in a second. So if you ask me what is wearables, I think it's an umbrella term. It's the classical, the bracelets and the watches, sure. But for me, wearables are also the patches, the dermals, and the things which will go into our body, the insidables or the ingestibles. Now, if you look to the classical wearables, João, I think they do have a future. And on one hand, you see a migration of the entry of non-contact devices, which no longer require that I have a patch or a wearable on me to measure heart rate and pulse and all these things. I can use radar now, or I can use ultrasound now in FDA certified devices. But I'm going to give you, I think, three examples which I really like, which tell me that the team is only starting. And the first one is something people might have heard of. It was a small company. It's acquired by Medtronic now, was called Clue. And Clue managed to use my Apple Watch and my wrist movement to identify, based with an algorithm, what I was drinking. So they could distinguish that this was tea, this was an espresso, this was a Coke, basically by looking to how my wrist was moving. So all of a sudden, the wearable became a proxy of a lifestyle factor and a diet or a beverage factor. And the reason why Medtronic acquired them is basically because in the future, we will not provide pills to people with diabetes. We will do lifestyle management. And a wearable might be one of these goals which will help to get to that goal. That's example one. A second example, way more recent, fascinating, it's the following. It's the way to objectivize itch or scratching. People with eczema or psoriasis, they scratch their skin. But imagine I make a drug to treat it, and I ask my patient, well, do you get better? What is better? I'm scratching less. Well, we start to have the first wearables now, which do measure hand vibration and movement, and they use that as a proxy to the amount of itching. So all of a sudden, I can quantify the effect of a drug by something measured by a wearable. And that is no longer the classical things people associate with wearables, counting steps or counting heartbeat. And then the third example, if I may, is really recent. It comes from the lab of Mike Snyder at Stanford and a collaborator at Duke, which has shown that using again a basic wearable like a watch, or it can be a Fitbit, that we might be able to use the parameters measured by these devices to look to biology. And if I tell you that I can look to the count of my white blood cells, which is a measurement for immune strength, or if I look to a number of T lymphocytes, which are a measurement for reaction of my body, so far I used or needed a blood prick. I had to go to the hospital, or the prick came to me, but at least I needed something invasive. So imagine now that by having large sizes, large numbers, I can show that I lower a little bit activity. My temperature goes up a little bit, and that becomes a proxy for a higher T cell count or lymphocyte count. I can count an infection no longer by a biological biomarker, but a digital biomarker. And so this way I can keep on going, but this shows me that yes, the field of wearables is just about to start, and that we will see a distinction between a wearable plus an algorithm to become a proxy of something. And in parallel, we will see wearables being replaced by non-contact devices into the certified clinical grade devices.
Fantastic, Koen. Thank you so much. Magnificent examples, very futuristic, and also I do agree with you. The future it seems very exciting, and we're about to start. I really like those examples, and also like you, I used to do keynotes around the world before COVID on wearables, and I used to finish with a very short video with a tooth sensor to manage some diet and distinguish the foods that we ingest. And people used to be really fascinated because it's something out of the box. It's not really
Yeah,
a
yeah,
watch or
yeah,
a bracelet that we see. So what you mentioned is
yeah.
truly the reality.
But
Thank
it's
you.
even more fascinating, if I may. Companies like Coca-Cola, and I intend to be an advisor to Coca-Cola for the innovation pipeline. So they start to think as a healthcare company as well. So imagine you can start to measure the things you just measure, how I taste, but also emotion and bonding, where all of a sudden a wearable becomes something which allows me to drink that Coke because I compensate by going out with you and making a social relationship. And so this way, we start to see that the concept of wearables entering basically every single vertical.
Yeah, fantastic. The engagement, the marketing, the branding,
Yeah,
so much potential. Yeah, fascinating. Moving on to the second question. What is the entire hype around digital twins in healthcare? And
yeah,
in your opinion, I see some stuff that you do. And in your opinion, does it relate to wearables too or not?
yeah, yeah. It's fascinating. Yeah? So just as a background, the concept of Apollo 13, which had a hard time to get back to Earth, urged NASA to make a copy of the capsule on Earth. They made a digital copy, if you like. Huh? The term was coined 20 years ago, and a digital twin is basically a virtual representation of a physical thing. And that thing can be machine, can be facility, a city, can be Earth, can be a heart. But in my opinion, and that's something I published, I think 3 years ago, can be a human being as well. The power of a digital twin is that we can start to move back to where we come from in healthcare more than 2000 years ago. You might recall that in some parts of China, the doctor was being paid as long as people in the village remained healthy. And once you got sick, you no longer had to pay. The reason why that worked is because the doctor lived 24/7 amongst his villains. And he saw that I was struggling, that I had pain somewhere, that I was pale. And basically, he interfered immediately. He anticipated immediately. Think about 2021. My patient is 8,700 hours a year not connected to me as a healthcare provider. So how can I be that Chinese doctor? Well, we can become that Chinese doctor if we start to think about the use of digital health and wearables to mimic that Chinese doctor, to enter into the real world of my patients and start to anticipate things in advance. And so the examples we have seen of using a simple Fitbit to identify corona infections 2 days earlier than a biomarker test can do it basically resemble what a digital twin will be able to do. It will be able to use not just wearables, but also imaging, of course, gait analysis to measure things a few hours, days before something moves off baseline. And this way I can anticipate. And so I see a digital twin as my avatar, which is fed with my biological data, my microbiome, my whereabouts, my social determinants of health, and all the parameters I collect with these wearables. Now, in order to show people, patients, citizens, the power of that, what I find fascinating, João, is that if you make a simple kind of model of one thing, that you can start showing to people what the impact is of something super simple. And let me give you two examples. We know, rehabilitation post-surgery. But one of the new things is prehabilitation. I used to be a cancer expert, and some cancer patients, they will basically respond to drugs better if they're fit. But what is fit? How cool would it be that I can give my patient something where he can monitor himself and can see on his avatar how fit he needs to be for the drugs to become reactive. And all of a sudden, he's motivated to receive treatment he cannot stand if he's not, well, fit enough by use of a super simple wearable. And a second example, if I may, you might recall these stories from, I think, 15 years ago. Golf players, they live longer, they're healthier. And there was one school who said that's absolutely bullish or rubbish because they are kind of higher social class, they have all the money to afford, and they can spend, well, better on healthcare. But people have recent data now that people who play golf, which simply walk something like 6 to 8 kilometers, well, that is enough to boost the immune system and to start making a number of immune cells which delay the onset of a cancer, which will hit me anyway at some point a little bit longer. And all of a sudden, I can start to translate the number of steps I take, well, how much I move, into a biological parameter, which I can model on a digital twin. And all of a sudden, I can start to motivate someone how I can prevent him or her from getting cancer. That is something people listen to. And that is why I'm really fascinating about the prospect of what twins will do. And if you then look to recent literature, companies like Accenture and Deloitte, they start to pick up these things and they call it the mirrored world. But what is really funny is that something like 2 years and a half ago, and that's the last thing I will mention, a consortium launched, which was called the Digital Twin Consortium. Basically, from an engineering perspective, they had a building vertical and a defense vertical and a infrastructure vertical, but nothing in healthcare. So I wrote them a little email saying, well, look, guys, I think the next big wave will be, well, human digital twins. Mm-hmm. And I didn't hear back for the first 6 months. And after 6 months, I got a little email saying, well, we didn't forget. And we start to see that there is some, well, traction in the world. And now we are half a year later. And together with a co-chair from Dell, I'm leading the healthcare vertical in the Digital Twin Consortium to show kind of the big tech companies what the promise is to bringing digital twin thinking to healthcare. And I think, João, that very soon we're going to see something like what Facebook has been doing with itself. Facebook made a copy of itself to play with. Well, I think we start to have the power to make a copy of the healthcare system and to start playing with different aspects of that and show how interference makes us, well, better doctors, predictors, and eventually preventive care providers.
Oh, brilliant! I mean, fascinating. So important points you mentioned. The Chinese example with turning the healthcare paradigm, if you like, upside down,
Yep.
because we have a reactive system, as you well know.
Yep. Yeah,
fixing system, as they call it in UK.
yeah,
But anyway, and then the potential of wearables with the digital twins and the data, and the potential is truly enormous. And I think we're just about to start to really exploring these possibilities. So thank you so much for sharing
sure,
these
sure.
amazing thoughts and possibilities. And the third and last question, Cohen, is what excites you the most in the space right now?
Interesting. There's a number of things, but the most promising thing see that there is a mind shift happening in a lot of people's minds, where I'm going to give you one example with what I mean. So I think in something 2014 I wrote a book, Sick No More, which was kind of a roadmap on how I believe digital health could kind of bring us back to that Chinese model. And one of the ideas was there, well, what if a hospital, which is currently built for the sick, could become something for the healthy? Could we start to teach healthcare within the hospital? And I'm so proud that my team now got the mandate from a number of hospitals, which are currently being constructed here in Europe, to help them build a ground level where we teach people, amongst other things, using wearables, what they should do to remain out of the hospital. So we are building the business model of the future in a hospital. And that is something which I really find fascinating, because that shows me that maybe instead of treating one person with diabetes, I will make more money treating 10 people with pre-diabetes, and I will make even more money from treating 100 patients with pre-metabolic syndrome. The only thing required is that mind shift. And what excites me the most at this point in time, that as human beings, we seem to be able to inspire and convey that message and have the first kind of hospitals which start to follow that logic. And therefore, we are currently thinking about launching kind of a hospital program worldwide where we help new hospitals show how they will be able to use digital health, being at the patient home, that decentralized trials, remote monitoring, to become also that Chinese doctor and to make more money, not by filling beds, but by being with their patients. And that is what really excites me the most at this point in time.
Oh, brilliant. What a way to finish. Before I thank you and wrap up, um, this is really fascinating. Cohen, thank you so much for your time. I finish all my episodes in a peculiar way.
Okay.
It's not really a question as such. It's called 1 minute of fame before I wrap up. So, down to you, 1 minute of fame. It can be anything, a shout out to any project, your personal achievements, professional achievements, family, anything whatsoever. So, over to you, 1 minute of fame.
Okay. Yeah. There's three things people want to do before they die. First of all, everybody wants to leave kind of something people remember: a child, a name, an ID. Second thing, people want to belong to something. They want to belong to a community. Even if it's a community of one, that's fine. But the third thing is really fascinating. Hardly anyone regrets what he has been doing, but most of the people regret the experience they haven't had. And that is fascinating because an experience, the ultimate experience, I call delight. And I think that the most inspiring message I can bring to people is not one about digital health and wearables, but about the potential that you can create experiences for your patients, your partner, your children by removing frictions out of their life and replacing the friction by a digital tool and basically creating the ultimate experience people want to strive for. And so, for that reason, I urge everybody to think like a delight thinker. Make yourself a patient or a customer delight person, and you find the digital solution to build that.
Cohen, thank you so much. What a way to finish. I mean, delighted to be here. I'm really going to grab that thought about experiencing more in life. Delighted to be here. I mean, thank you so much for your expertise, futuristic thoughts, and knowledge and insights.
Yeah, and it's super simple, João. I mean, everybody understands delight. I mean, give me an experience why I come back to you. Think about that hospital who might tell you you no longer have to come to the hospital. I mean, I can be that. And we find the tech so that. So I'm no longer a tech sales guy. I mean, I'm a delight sales guy in
Mm.
a sense. And that is what I try to instill in everybody. Try to think that way.
I love that, Koen. Thank you so much. What a way to finish. Thank you so much.
Okay,
And
pleasure was mine.
Koen, thank you so much for your insights, your time, your expertise, and thank you to our subscribers and listeners. Make sure you share all these magnificent content. Check our global partners, Spirit Digital, and I'm going to put Koen's email and contact LinkedIn, all the contacts in here. Make sure you connect with Owen and ask him about these magnificent projects. And I'll see you all next week.
Fantastic. Thank you very much.